I know syphilis and gonorrhea.
Gonorrhea, syphilis, there is also HIV.
Yeah, I know there is chancroid, there is gonorrhea, syphilis, HIV, and AIDS.
I know syphilis, I know gonorrhea, HIV.
Well, good morning, good afternoon, good evening from wherever you're watching from. And today we are going to talk about an interesting topic, STI, and the fact that people know what STIs are and how they infect, they can be infected. There are so many controversies about it. I am here with Dr. Charles Wachisha. Did I get your name right?
It's Wachihi.
Wachihi.
Yes.
I am here with Dr. Charles Wachihi, and he's going to help us break down what is STI, how do people get it, and how we can prevent ourselves from contacting STIs. Dr. let's start with the basics. What
Thank
is
you very
STI?
much. So, I think we know about STIs, we've heard about STDs, you know. So STI stands for sexually transmitted infections. STDs is essentially means sexually transmitted diseases, often used interchangeably, right? However, for the most part, the STI precedes the STD strictly, but it actually almost means the same thing to most people. So STI would actually just mean the infection itself. The STD often means now the disease that shows up, whatever disease you have, all right? So, but we tend to use them interchangeably, but they don't alter what you need to do as a patient, and what the clinician will do.
So, do we have figures in Kenya when it comes to STIs?
Yes, we do. We do the general figures. So, I think, for the most part, if you think about figures, by figures I know you mean for the various types of infections or diseases. Are there figures? Now, in this case, to understand, figures will only help with, quantifying how much disease there is. And these figures tend to be more useful now to people planning for medicine, planning for intervention, like knowing, for example, in a certain area, there's a large increase in a certain case. The ministry or the health officials will move in. So, but there are no absolute figures, all right? But by the time we start discussing the various specific diseases, we'll be able to talk about the various figures. But on average, you can imagine STIs will be prevalent in the sexually active category, all right?
Yeah.
And they tend to be, almost equally spread between men and women, all right? But it's mainly, by the various types, you'll get that variation, all right? But for the most part, why you see I'm hesitant to start mentioning figures is that it doesn't mean that if I tell you 1%, it doesn't mean that, because you see most people are undiagnosed. Because sometimes they haven't gone to hospital, all right? And so we focus on really you knowing what symptoms you might have. That's part of the reasons we're here, so that you can seek appropriate care, all right? Because there's no time you can tell me because there are five out of 100 people have the infection, you don't know where you are. And some of the presentations of the diseases are not, black and white, So it tends to be very gray, right? So for the purpose of this conversation, let us know that they are prevalent. A lot of times they are hidden, they are not apparent. You may not know you're actually infected until a little much later. So it's very good to be alert. Yes.
So now that STIs are actually spread through sexual intercourse, probably you can give us some types of STIs in both men and women.
Nice. So let's go back. So infections are caused by organisms, right? So I'm sure you remembered things like bacteria, viruses, and in protozoa and all these things, right? These organisms are in the environment. Now, by chance or by design of the organism, so there are those ones that tend to cause infections in the reproductive system. But remember, they can also affect other parts, right? So, for example, you find, we've had the common cases. We've talked about, I'm sure you've heard of cases of watu wamechomeka, sijui wamefanya nini. Those are the common descriptions. If I go for a short call, I'm feeling pain. So people associate a lot of these small things with symptoms with STI and all the time.
Yeah.
But strictly, right? STIs are actually divided into those that, for example, will cause a discharge. These are cross-board, men and women. There are those that will cause ulcers, like a break in the skin. So there are those that will cause a discharge. There are those that will cause a break in the skin, comes out as an ulcer. The ulcer may be painful or painless. And there are those that cause neither. All right? So that's broadly saying how you classify the STIs. But now let's change another way of grouping by how they would probably present. All right? That those that will present with what we call a urethritis. Now, for the man, that simply means going for a short call, there is pain, there might be a bit just discomfort when you're going for a short call. And that's because the area, of where the urine is passing has issues, is inflamed, all right? Because oftentimes you find for the man, the same gadget the man uses for going for a short call is the same gadget for normal relations, right? And then you find for the lady, so let's look at urethritis. So for the lady, you find there's a bit of difference in anatomy. So urethritis, in the case for urethritis in the old lady, it may be a different syndrome that is coming in. So you find it may be a classical STD, it may not be. So what the lady will be feeling, going for a short call, going a lot of times, and then a bit of pain, so that's that. Then you find there's discharge, right? So someone comes with discharge. Again, because of differences in anatomy, different organisms may be causing this. Again, you find there may be ulceration, okay? Again, different organisms cause the ulcers, all right? And then you might find now for both men and women, there may be low abdominal pain, all right? Again, different organisms will cause this, all right? And then in other extreme cases, now for the ladies, you might find there may be bleeding, all right? And there may be much more severe low abdominal pain because of the pelvic anatomy. So you realize a lot of times the signs, they're not so clear-cut. It just simply needs you to be aware there's something different. So for example, there it's very broad and complex, all right? So let's go back. Let's take, for example, urethritis. Let's still go back to urethritis. Urethritis, I said, it's the passage, the pathway for the urine when it gets inflamed. Now, it can be inflamed by a bacteria that is not sexually transmitted or not, all right? Now, when I say sexually transmitted, there could be other bacteria that are in the general vicinity of the pelvic area but are passed through intercourse, but they're not classical STDs. So you find, if we get into that detail, it gets very complicated. So what I like telling patients is to be aware of the symptoms. All right? Just be aware of your symptoms.
So, Dr. I have a question.
Yes.
Now that STIs are sexually transmitted, I haven't had sex for let me say for 6 months.
Yes.
Or let me say I'm not sexually active.
Yes.
And when I go to the washroom and as I urinate, it's itchy, it's painful. Does it mean I have an STI? Because it's a bit confusing.
Precisely. That's why you've noticed I've talked more about the syndromes. there's one syndrome that I haven't mentioned. There's a fungal element in sexually transmitted infections, but they're not classical STDs. There can be some bit of transmission, but most times it's more, we call them because of an imbalance. So for example, candidiasis, all right? So candidiasis can be transmitted from one, from one partner to another, all right? But the syndrome is different. But in itself, it can also develop because of changes in the flora. Now, the pelvic anatomy, the female anatomy is very unique in that it is designed to be self-cleaning, self-maintaining. So it's supposed to, the things, the bacteria we call the lactobacilli, maintain what we call an acidic environment. An acidic environment is designed to be very hostile to anything growing. So occasionally, in some cases, maybe because of modes of self-cleaning, maybe medicine you've taken for long, you find it kills a bacteria. The environment changes, fungi grow. Now, when the fungi grow, then you get the candidiasis coming in. Then other patients have other conditions, for example, that alter again the same balance. All right? So diabetes. So you find, you see, and this is where we tell patients, don't sit back and try and go through this information in your head because you're going to get lost. So come to us with the symptoms. Don't try and self-treat. Because when you come to a healthcare worker, it's my work to sift through all that information based on the story you give me and help you and I come to a conclusion as to what you're suffering from. Because as a patient, I'll tell you the truth. If you sit and try and think through, you can Google the whole day and you will not come to the correct conclusion.
Now, talking about that,
yes.
And a patient comes to the hospital and I am having all these symptoms, and then I don't know how to express it. Maybe you tell us what are the features you see when a patient comes in and they're afraid of just saying what they feel or what they go through.
And don't even ask that question like it's an uncommon occurrence. It's more common than not. Unfortunately, sometimes you might find a healthcare worker who's judgmental. And we've seen these cases where you come to me, and especially we see this because we especially being African, and I guess it's also a Kenyan thing sometimes, we are afraid of discussing things related to sexual matters. So for someone to come and tell you, I am having a discharge, that person is more likely to call a doctor on phone or text someone than go to a clinician and say, I'm having 1, 2, 3. Let me give you an example before we even go. When I was, as part of our training, we do a bit of internship at hospitals. I remember a time when a gentleman came and he had an issue, but he waited until the reception was cleared before he came to where I was to start saying the issue. And that time he's not going to speak. He didn't speak audibly. He mumbled something. It's after me going to him, I can't hear what you're saying. And then that's when he said, "Nikuna shida fulani." So he was embarrassed.
So men also have a problem when...
So it's not just men, I'm saying everyone. Women have a problem because it's embarrassing. You know, that time, you're afraid, they're afraid, I know you're afraid of being judged. How do you have this issue? How do you have this issue? What have you been doing? So, and unfortunately, these judgmental attitudes sometimes show in the face. We talk about the non-spoken, the non-verbals. And people are very sensitive in that situation, right? And so they're suffering, maybe there's something they did, you don't want to first focus on that. So they tend to. So the symptoms that will come, as I told you. So for a man who come and tell you, when I go for a short call, there's pain. Ama nikikojoa nahisi uchungu. All right? That's actually the commonest thing in men. Nikikojoa nahisi uchungu. Ama anakuambia nikiamka asubuhi kukojoa, mkojo unaenda kila mahali. That tells you kuna discharge. Ama akienda kukojoa, ni kama pale mbele kwa the male member ni kama pameziba. All right, because we rarely see gonorrhea. Gonorrhea now in this case was a situation where the male member imefura na kuna usaa unatoka, very painful. Classical gonorrhea, difficult to see. We still see it in very remote places. Increase ya kutumia antibiotics hatuioni hiyo sana. So what we are seeing are other infections, and I think hapa, let me first say one of the commonest ambazo hizi syndromes zote tunasema is chlamydia. Chlamydia is a very silent STD, but it's very highly prevalent. It's highly prevalent, young people, just sexually active people, right? It presents as, you know, most of the time it's just a bit of discharge, clear discharge. There may be swelling of the testicles. So those are now the symptoms you find with chlamydia. So what you're trying to see, as I'm giving you an example, every symptom is based on the organism, right? So that's chlamydia. So let me repeat. So chlamydia, it's a bacteria, you know, will mainly cause just a bit of discharge in men. Bit of discharge early in the morning, it's clear, there may be swelling of the testicles, and that's it. But it has serious consequences because it has affected the testicles. It might cause infertility over time. So men will see this and they will not be able to know what it is. Now in women, chlamydia is silent. It rarely causes any issues because you see, for the men it causes them discomfort because the P part, the short call part and the sex part, everything passes through the same, so it's the same area. But for women, because of the separation in the anatomy, that causes an issue. And chlamydia is very common. It causes inflammation in women, tubal blockage, masses, you know, what we call infertility. It actually can lead to blockage of tubes and other more serious problems, you know. And it's very prevalent in young people. Now, let's go back to another presentation. In women, you find discharge. It's more common discharge, right? So for discharge, again, in women, you find, for the most part, the commonest cause of a discharge in women, it's actually an imbalance in the bacteria, the vaginal flora. So there's normal flora, then there's abnormal flora. So you find that abnormal flora causes everything changes, and then you have this discharge that doesn't seem to go. Unaoga lakini ungari.
So it's the discharge that smells?
Exactly. It has a fishy smell. Very discomforting, you know. And if you don't go say this to the clinician well and you know, articulate, he may not give you the right treatment. So just learn to speak. All right. Then there's another one, you know, as we continue. Then there's an STD called herpes. Herpes, you know, because of a high rate of you know, cases of herpes, over 95% of people actually been exposed to herpes as long as they're sexually active. You find it presents painful lesions, small pimples. So there are type 2. There are two types of herpes. There's a one that affects the lips.
The lips.
The one that everyone says homa, niko na homa. It's a type 1. So type 2 ndio inashika the genital area.
Yeah.
And you find, sasa hiyo, you find a reactivation. Once you get the infection inajificha. Every so often zinatokea. Na huwa zinakuja ni kama pimples ndogo, zina maumivu. Zikija zinakaa siku 4, 5, you know, to 1 week, then they go away.
Yeah.
Zinakaka, zinarudi. Zinazaka 3 times in a year, then zinakuja once in a month. So you need to be aware when you see these things. I'm just really saying these things just so that you're aware to seek the right treatment. Unaona? Because every of these things unasikia nikisema kuna treatment approach yake. Unaona?
Yeah.
Yes. And not every person in the chemist atazijua. Unashika? Yeah. So hata sijamaliza. Hapo sasa nimekuguzia tu juju. So the symptoms, what you will realize that there are very many types. Sasa kuna zingine na tujamaliza. Something like HPV. Now HPV mara mingi haina dalili, but wakati imekuja inakuja na warts. Right? Not everyone get warts akipata HPV. Most of the time hakuna chochote utapata. Because tunaita it's like it infects the cells inside. But wakati kuna issue, it causes an abnormal multiplication of cells. Sasa kuna vitu zinavimba kwa sehemu ya kizazi. Unaona? Yes.
So
unanielewa? Bado hatujamaliza. Then there is syphilis. So lazima tuende na the type of organism ndio uelewe
yes.
the sign and symptom. Then there is syphilis. Syphilis nao ni nyingine. Most of the time haina dalili, but the classical presentation inakuwa ikija in about many cases primary syphilis wapata kama kakidonda akana maumivu. Again hatuoni percentage rate yake iko chini sana kwa sababu bacteria antibiotic nyingi zinaimaliza. Yeah. So now ni ile inakuwa na stage primary, secondary, tertiary hivyo. Primary, secondary, tertiary hivyo. So unapata yani symptom ya kila kitu inategemea. Alright? Then kuna sasa zile inakaa kama STD lakini si STD. Hapo sasa ndio nimekutajia. That's why we call them infections kwa sababu they are bacteria that stay. Now let me tell you. For example, in ladies, the proximity between the anal and the vagina, the anus, the vagina and the urethra. Sometimes you get to transfer from the the large intestine has a lot of bacteria. Nyingi sana. And it's the same for everyone. Sasa hizo bacteria saa nyingine zinasonga zinafanya nini? Zinaleta vurugu huku juu. Because there may be transference during intercourse. Sometimes for things that might happen, unapata bacteria ikisonga. So unapata bacteria moja tunaita E. coli. Iko sana kwa the large intestine. Huwa inaenda kuleta vurugu huku. So unapata patient comes a lady now, she's in pain. Akienda haja ndogo kuna maumivu. Kumbe ni E. coli, lakini yeye atafikiri ni sasa unajua now the implication here if she's in a relationship anafikiri mzee ameleta hii maneno. Unaona? So hapa ndio uzuri wa kwenda kwa clinician ndio mtaweza kukaa mka elaborate vizuri that this is not this, this is this, Yeah. So wacha niachie hapo because so you can see everything has its own, every organism has its own presentation. Na hata sasa kuna zingine zinakuja sehemu nyingine. I can give you an example. People who practice it's possible for example for this organism to infect other parts of the body. Right? Like if you're doing anything related to intercourse, manual stimulation. Hiyo mikono na kuna shida kule. Hiyo mikono ukiguza jicho bala. Acha tuachie hapo.
So for a very long time. And maybe we talk a little about HIV na STI because HIV is also part of STI.
Hiyo nimeacha kando tunaelewa tu hiyo ni ile kubwa.
So for a very long time now HIV has been on the focus and STIs have actually taken a back seat. And you find that people who are loyal to their ARVs, HIV positive people who are loyal to their ARVs and they don't actually give the signs of virus, their viral load is undetectable. They sit and tell themselves, I don't actually have a virus to transmit to anyone. And they decide to engage in sexual activities without even protection. What would you say about that? Because for me, it's part of the ways that you get to transmit
HIV.
STIs.
And STIs.
Yes.
Now, you've asked a very loaded question. First, you've actually asked about issues related to what you've actually asked is about HIV viral load and sexual activity and transmission. But let me go back. Let's go back because let's say you're asking. So let's look at it this way. When you have an STI, it means when a patient has an STI, that means there was unprotected sex. Okay? So there was exposure between two people probably who know their status, HIV status or not. Okay? So again, it depends on the circumstance. All right? So the unprotectedness is not the issue. Is that the status is a no? First of all. But now let's go back a little bit. There are most STIs, for example, will cause changes in what we call, now I'm going to introduce a term here that is a...
I hope it's a simpler term for us to understand.
Right now as we sit, I'm trying to filter it. So let me put it this way. HIV, as we know for a long time, infects certain types of cells. When HIV gets into the body, it doesn't go all over the place. Kuna mahali inaenda kwanza. Alright? Ni kama unaweza imagine kuna lengo lake. Ni kama mshale, okay? Na wakati uko na, when you have an infection, and the cells that it targets are the same cells that fight infection. Tunaelewa? Sasa HIV uende inagonga hizo, inazivuruga. This is why uwaga kwanza ukisikia HIV umeingia, we talk about immunity. Kwa nini? Si because hizo ndio upigo. So in short, HIV ndio vuruga immunity, si ndio? Na ukumbuke, when you have an STI, what is your body doing? It's fighting infection. When you have an STD, when the body has a foreign body, but like the human body has an infection, mahali popote, hata kwa, even kwa tooth, see it swells. That is a sign of the body fighting the bacteria.
Oh, yeah.
Now unanipata. So when during that fight, so unaimagine mtu akona STI, si sasa cells zimekuja kupigana na ile STI. Then kumbe HIV imetokeleza. Are you seeing my point? So sasa umeletea HIV virusi vya kugo. So when the body is trying to fight HIV, fight the STD, HIV iko. That is why we say having an STD increases. Now this is now I'm coming to, I was explaining the term I was about to say. Having an STD increases the risk of getting HIV when exposed. Because already ushaleta zile cells wapi? Pale. Haya. That is one. Number two, again, having an STD when you have we have HIV, it increases chances za kutransmit ile virus. Because pia ukivuruga. Now what HIV does, it takes over the immune system. So anytime cell inafanya kazi kujaribu kufight infection, you actually produce more HIV. So una increase transmission, na una increase risk of infection. So anytime uko na STD, ujue chances ya kukamatana na HIV, kushika HIV, kutransmit HIV iko juu. So ukija huwa tunapenda kuziangalia zote. So hiyo ndio sasa, it's almost like an unholy alliance. That's the risk.
Maybe you give us the prevention strategies for STIs before we finish this.
Prevention strategies za STIs. No, ukiangalia story yote tumeongea. One, abstinence. It's sexually transmitted. Abstinence ni number moja, if you can. All right. The other things,
for those who cannot abstain in this
generation,
because we are in a generation where we have normalized things that should not be normalized.
Yes.
So if you cannot abstain,
that's one. Lakini unajua nimeanza na abstinence. Sasa kama huwezi abstain, kuna kuwa na the other issue. Now it's about behavior. One of the biggest problems ya sisi ni multiple partners. Multiple partner mmoja ambaye amejua status yake, amepimwa naye, mwaka naye. Sio? That is fine. One partner, status known, HIV status, STD status knows, and you're faithful to that partner. And then there is the condoms. Condoms work when used consistently and correctly. They work. All right. And then if you have an infection, prompt treatment. Again, because it may come to someone ambaye sio, like one of the partners, the other partner might bring it. So prompt treatment and appropriate treatment prevents the ping pong infection, So those are really some of the strategies to do. But the biggest thing is, be aware when you have an issue, come and talk to us. The clinician, wherever you are, there has to be a healthcare worker. Yes. Go and ask the right question. Don't just rely on Google. Get the right treatment at the right time. You will prevent a lot of, what I call the domino effect. What you ignore now causing problems later.
There's a lot to talk about when it comes to STIs, and we will be back with more. I want us to talk about men, women separately. We will talk about that. Thank you for coming. Thank you for your time. It has been nice, and personally I have learned a lot. I hope you have learned, and please, let's stop this. Let's stop normalizing things that we shouldn't normalize. We will be back with more on STIs. Stay tuned.